Hello, so I just got home from my psych rotation and I'm going to recap some of the things that we talked about because my preceptor was really nice today and stayed for like an extra 45 minutes to give us a very conversational lecture in which we talked about eating disorders and mood stabilizers, and then because it was so conversational we also had some little side tangents that were pretty fun. So primarily he wanted to talk about the eating disorders. He wanted to talk about anorexia nervosa, bulimia nervosa, and binge eating disorder. Now, he started off with anorexia and asked, what's the diagnostic criteria for that? So then we said, well, it's BMI, body mass index, below 18.5. He goes, that's correct. Now, what is the criteria for binge eating disorder? So then we said that it's basically uncontrolled episodes of eating without any compensatory behaviors. So no exercising excessively, there's no trying to throw up afterwards, and there's no using laxatives. And then he said that everything else is basically going to fall under bulimia nervosa. So anorexia, binge eating, and then bulimia nervosa. Bulimia nervosa, the patients have a normal BMI, but they eat in huge periods or they restrict in huge periods, and then they will have compensatory behaviors where they purge or they will abuse laxatives. So he said something that's important is everybody knows that they tend to throw up a lot or try to force themselves to throw up, so that we're not going to get questions on that. What we will get questions on is they'll give us a bunch of electrolytes and we'll have to see, oh, well, if they're in metabolic alkalosis, yes, that's throwing up. But if they're in metabolic acidosis, that's because they're abusing laxatives. Now, there are treatments for all of these, and if there's ever a question and cognitive behavioral therapy is an answer, go with that. But anorexia nervosa has no FDA-approved pharmacotherapy for treatment. But it's pretty hard to find a patient that has anorexia and doesn't have a comorbid condition like depression. So therefore, always give them SSRIs. Now, bulimia nervosa does have an FDA-approved medication, and that would be a specific SSRI, and that's fluoxetine. Binge eating disorder, the appropriate medical therapy is something that decreases appetite, specifically a stimulant called lisdexamfetamine. And then he kind of went on to a tangent here, which I won't get into, but he talked about how pharmacotherapy is approved and how some drugs will have off-label uses just because it didn't get FDA approval. From here, we kind of went into a little bit of a side thing about body dysmorphic disorder, because